Hello, the virtual town hall of Big Sky and Southwest Montana. Um, Welcome to the town hall for um, our backyard. Let me welcome all of our friends, families, neighbors, and extended businesses to our virtual town hall. My name is Eric Ladd, and I am CEO and publisher of Outlaw Partners and explore Big Sky News and Media. Outlaw publishes a variety of news publications, and we are grateful for your support of local media and journalism. I am joined today in hosting this with my managing editor, Joe O'Connor, and a distinguished group of panelists. As Big Sky's news and media source, we take our job of reporting the news very seriously. And with the recent COVID pandemic, our readers, you, have asked for more coverage and more integration into the decision-making that is taking place in Big Sky in Southwest Montana. Communication is key in life, especially during times of stress and uncertainty. We recently did a community-wide survey, and many of the topics you listed as important are covered today by the panelists. One of the pieces of feedback was more news coverage, and Outlaw Partners is committing to that. Since Big Sky is not incorporated, we don't have formal governance to rely on and dedicated leaders who are appointed or volunteer to lead during times like this. Instead, we have an amazing group of people who sit on various businesses, boards, groups, or charities that make these decisions. Today, we've assembled a diverse group to not only address the medical component of COVID-19, but also to discuss the surrounding issues such as relief work, aid, small business consulting, social issues, worldly outlooks, and the future. Our job in media is to inform the community on important issues, ask thoughtful questions, work with community resources available to us, and encourage our readers, family, and friends to look to the future. In Big Sky, we are lucky to not only have means, but also an incredible community of brilliant minds with amazing experience on the world stage. The town hall format is a way for us to bring those minds together and in combination with your input and questions, create a healthy dialogue to help us with decision making. Today's format is fairly simple. We will spend 10 to 15 minutes asking each panelist a series of questions, at which point you are welcome to submit questions for consideration. You can submit questions via the comment section on Facebook or the questions button on Zoom. At the conclusion of this, we will integrate more questions if time allows. With that, let me introduce our diverse group of panelists. Let me state that I'm very grateful for each of them being willing to not only contribute their time, but also their knowledge, expertise, and dedication to help during these uncertain times. The goal with this group is to have a mix of locals as well as advisors and business people in and outside of our immediate neighborhood. Today, joining us from Big Sky Medical Center, we have Taylor Rose. From the Big Sky Chamber of Commerce and Visit Big Sky, we have Candace Strauss. A leading healthcare industry venture capitalist, Gary Rieschel. From Big Sky Relief Fund and the Big Sky School Board, we have Loren Bough joining us. A sixth-generation Montanan and businesswoman, Whitney Williams. And from Big Sky Resort Area Tax District, we have Kevin Germain and Danny Burschwal. So with that, I'd like to welcome our first panelist to the stage, Taylor Rose. Taylor, thank you for joining us today.
Hi, thanks for having me.
Wonderful. First off, on behalf of, I know a lot of people say this, everything that you and your team are doing and being on the front lines of the medical situation with this, we are eternally grateful to all of you and to know that we've got such an incredible resource, not only in our region, but now in Big Sky in our backyard. Thank you.
Yep.
Let me dive right into it. What is the current state of COVID situation in Big Sky and our immediate region? We get plenty of news, I think, on the nationwide scale and the world scale, but how would you bring it local for us? And you know, in particular, the question we get asked a lot is any insight to the numbers and what's happening in Big Sky?
Yeah, the numbers that we share are just what the county health department is sharing. The county health department told us that, you know, they're going to be the ones to disseminate. So we're sharing on a level that the current status from the Gallatin County numbers are what we share, and then any hospitalized patients from Bozeman Health will be shared at that level. You can imagine we like to protect patient privacy and everything. So those are the numbers we're currently sharing, and right now we have no hospitalized COVID patients at either Bozeman Health Big Sky Medical Center or Bozeman Health Deaconess Hospital.
Great. When you look at some of the curves that are out there, in particular the IHME curve, they predict COVID's going to peak here in late April. How does that line up with what you guys are seeing, or do you guys run your own internal predictions or projections on how we're doing as a county or area?
Yeah, we're currently managing kind of one day at a time here. It's an ever-changing situation. We're evaluating the curve. We're trying to minimize the curve, obviously, by taking certain health precautions into effect, the visitor restrictions and social distancing precautions that we've put in place at Big Sky Medical Center and around all of Bozeman Health, reducing non-urgent surgeries and canceling and postponing elective procedures and visits. So we are looking to reduce that curve. We're not quite comfortable to say like where we're at the curve because it's kind of hard to tell every day, but we are confident in our ability to address the current situation and where we're at. We are confident in our staff and our capacity right now. Excellent.
So I was going to kind of dovetail into, being able to handle patient load in Bozeman and Big Sky, and it sounds like that hasn't been an issue right now. Has there been any additional protocols? You mentioned that you have changed some of the protocols at the hospital. Any other additional protocols in your medical facilities that you'd want people to be aware of? Any changes?
Yeah, currently we have some visitor restrictions going on that people should be aware of. It basically boils down to we are not allowing visitors in the hospital, emergency department, or the clinics or our inpatient beds. There are some compassionate exceptions to this and some obviously pediatric juvenile exceptions. If the patient is under 18, they can have one visitor to accompany them. And there's some compassionate ones as well as far as if the patient needs a visitor for specific health reasons or if end-of-life care, those types of things. But the basic message is we do not have any visitors at our facilities right now. We'd encourage those that are seeking care to seek care, but visitors will be asked to not visit. Any person coming into our facility will be screened by a professional with a thermometer and asked some screening questions. And we're not allowing anybody who's running a fever to be in our facility unless they are seeking care. And if you do screen positive for any of our questions, you'll be asked to visit our up-and-coming viral triage clinic that we should have up and running by the end of this week at the latest. And it's 3 rooms that we've set aside to treat these patients and to help them stay away from the rest of the campus so that we can still have those visits being seen and people can still seek care kind of knowing that they are separate from those people being triaged for viral diseases like COVID or the flu.
And is that triage clinic, is that something that's in Big Sky or is that Bozeman?
That is in Big Sky. We should have that up and running by the end of the week in Big Sky.
Okay, excellent. At this time, does Big Sky Medical Center have sufficient testing, PPE, ventilators, a lot of those hot button topics that you're hearing discussed on the national scale?
Yeah, we feel confident in our supplies right now. We have some additional ventilators thanks to the generosity of the community in Big Sky. That we've got 10 ventilators coming to the system. 3 of those will be coming to Big Sky Medical Center. Our current ventilator count is 1, so we'll be quadrupling our ability to do ventilators. And we're also building out 4 additional inpatient rooms that can help us address the patient needs up here. Those should be constructed by about May 5th is the current timeline, but those construction timelines do change. But we do feel confident in our current ability to address those, and we are preparing for an even higher demand from the community and just really trying to beef up our ability to address this COVID situation. But right now we do feel confident in our ability to address it.
Excellent. Before I turn over to Joe, just to see if any of our audience had any questions, do you have any needs or requests from the Big Sky community? Anything beyond equipment, but just in terms of, us all in this together, any requests of the Big Sky community?
I think that, the message that you hear everywhere is stay home, stay away, and stay away from people. We want to be the resource for care when people need it. And so if it's if you would be seeking care based on your symptoms, please call in and ask some questions. This is what I'm dealing with. Can I come be seen? We'll kind of triage that and evaluate if a virtual visit is best for you or if you do need to be seen on site. And of course, then as always, if you're experiencing an emergency, please dial 911 to get that care. They can get you to us. Emergencies always we want to take care of. We just want to keep people in the right frame of care and make sure that they're receiving the right level of care in this situation. So.
Excellent. Well, I appreciate that. Joe, is there anything from the audience you'd like to bring up?
Yeah, absolutely. Thanks, Eric. And thank you, Taylor, for joining us. We really do appreciate your time.
Yep.
We've got a question from Maggie Good. It says, Bozeman Deaconess is significantly smaller than hospitals in Billings, Missoula, and Great Falls. Is there a plan to transfer, if needed, to some of these other locations?
Bozeman Health is working regionally with the health departments to look at the bed availability across the state, and we participate in a collaboration where we submit all of our beds on a daily basis, what we have available, and that goes into the state where they're able to look at the availability across the state. So we are participating in that, and if the need arises, we will be sending patients to other locations. The level of care that we're able to provide is that ICU level of care that you would find in other locations down in Bozeman. So as a capacity, once we hit capacity, we would probably be looking to our partners in the community and across the state to help us offload some of those volumes. We do, Gallatin County is getting hit harder with COVID than other parts of the state, so we would lean on those partners across the state to transfer patients if need be. And we feel confident in our relationships with them and our ability to do so.
Gotcha, thank you. We've got another question here from Diane Bartik. Can we get our doctors not dealing with coronavirus patients to have office hours up at the Big Sky Resort Clinic? We still need to receive our health needs and have those attended to. Any response there?
Yeah, our doctors that are not dealing with the coronavirus pandemic, sorry, not epidemic, but they are currently still seeing patients at our clinic here in Big Sky Medical Center. We are trying to shift as much of that out to a virtual visit as possible. If the doctor does need to get hands-on and they do need to see you, they will be asking that you come into our clinic. And part of I mentioned earlier, the viral triage clinic that we're setting up is to help enable our doctors here at the clinic to see those patients without worry that they're going to be mingling with our viral patients that we might have coming into the facility. So there's a shed that we've placed outside the front entrance that will screen and triage patients to either, if they're part of the viral clinic, they'll be asked to go around and use a separate entrance. And then if they're being seen in the clinic for lab, for imaging, or for just seeing the doctors in the clinic, they'll be allowed to go in the main entrance.
Mm-hmm. Understood. Thanks for that. One last follow-up for you. So at last Friday's Big Sky Relief Fund meeting, you mentioned local production of reusable masks. I was wondering if you could elaborate a little bit on those developments.
Yep. So our foundation is coordinating all the community donations that we're getting, and part of those is down in Bozeman, there's been some groups that have gotten together. They've worked with our healthcare system, and they've developed a mask that can be washed and reused to help hopefully offload some of the needs that we're seeing for our disposable masks. We're also, Sims has been the clothing and fishing wear, Sims has been gracious enough that they're going to be developing reusable gowns that we can put on and help protect us as personal protective equipment, PPE, for the hospitals. We've seen just a lot of community donations of these masks and gowns that people want to help out, and they're all being ran through our quality and safety department that's in our incident command structure to make sure that they are addressing the actual need. And so if there is somebody that has, you know, the ability to produce in a large quantity some of these things, I'd have them reach out to our foundation, the Bozeman Health Foundation, and they can coordinate how to make sure that they meet our needs and that they're useful and we can utilize those to go forth.
Yeah, understood. Well, thank you, Taylor. Much appreciated. Eric, we'll go back to you.
Excellent. Thank you. Once again, that was Taylor Rose, Director of Clinical Services and Operations at the Big Sky Medical Center. Very grateful for all their team's hard work. As we said today, we're going to kind of have a diverse panel. We're going to do everything from talking about COVID to talking about other issues. So we're going to switch over now to Candace Strauss with the Big Sky Chamber of Commerce. She's the CEO of the Big Sky Chamber of Commerce and also runs our Visit Big Sky. Candace, thanks for joining us today.
Thanks for having me, Eric.
Wonderful. I'd like to spend a little bit of time just getting your kind of insight and advice for especially our small business leaders of the community and people that are going through this from the business perspective. Any updates on financial aid or any of the processes that you can help distill down for our small business owners in Big Sky?
Absolutely. And hopefully many of them got some clarity just like we did at the Big Sky Chamber today. I will just say that leading up to Friday, where our president just signed the third phase of the coronavirus relief packages that have been coming down the line, it's been complete and utter chaos with the political process in Washington, D.C. between the House and the Senate. So trying to kind of nail down any of those details of those federal aid packages was just not a worthwhile endeavor. However, the president did sign on Friday afternoon, on March 27th, the Coronavirus Aid, Relief, and Economic Security Act. It's called the CARES Act. And as I mentioned, that was the third phase of economic relief coming for our small businesses as well as individuals. So we'd just like to walk through that a little bit. We offered a webinar this morning, which is recorded, and we will be sharing out via your channels after this for anyone who missed it, from the National Federation of Independent Businesses, which is a membership organization just like the Big Sky Chamber, but really deals with an average member size of only 10 employees, which we see a lot of that in Big Sky. So on March 6th, we saw the first phase of COVID relief coming through the Coronavirus Preparedness and Response Supplement Appropriations Act. Well, I'll say that one fast 5 times. That is what instituted the Small Business Administration Economic Injury Disaster Loans. And that is available to businesses under 500 employees. There are a lot of details with each one of these aid programs, and I don't want to use this forum for that. The PowerPoint that we will share out afterward has all of those specifics, but it required disaster designation from the governor on the state level, which all 50 states and the District of Columbia have now received, and so are all eligible to receive these funds. It is being run through the SBA, and it's an online application process, and I don't want to say simple, but for all intents and purposes, not overly complicated. The second phase of relief came from the Families First Coronavirus Response Act, or the FFCRA. That was enacted into law on March 18th. It provided the paid sick leave and family medical leave mandates, along with payroll tax credits and unemployment insurance assistance. Again, we as the Big Sky Chamber are not trying to position ourselves as experts either in the tax arena or the human resources arena. A lot of these are very specific to laws, and we're just trying to make sure that we're providing a conduit to the experts to provide that to our businesses. But again, the PowerPoint goes into who's eligible, what that looks like, how to file for it, when it pertains to. Each has different timelines. And then how you receive those funds. Excellent. The one on Friday was the biggest one. It provides for a paycheck protection program with forgivable loans, tax relief, and unemployment expansion. And so all three of these things combined, I think, will help our small businesses greatly. There's relief, and like I said, many are forgivable for payroll, for rent or mortgage if you own rather than are leasing. For some immediate expenses related to debt. And so really going to help take care of a lot of our small businesses in Big Sky.
Excellent. Well, thanks for helping distill the 900 pages. It's appreciated. I know that's a little early to say, but thus far, how have the businesses been faring during the shutdown? And I think a subsection to that is from your lodging partners, I think are particularly hit very hard. Are we getting any insight to, are they already seeing impact that's going to drift into the spring and summer?
Well, to answer the first part of your question, I think what we've seen from our businesses in Big Sky is that everyone has rallied together to support our community, as you led off with our session today. Hashtag Stay Strong has been circulating around the community about how we as Big Sky have many times before seen hard economic times fall on us and have come out stronger on the other side from them. So I want to applaud a lot of our frontline workers that are at Big Sky Medical Center, as well as the fire department and sheriff's department. But we have to also look at our retailers and restaurants who, in light of a dine-in ban through April 17th, are still continuing to serve us. So we're doing takeout Thursdays, we're doing frontline worker Fridays to just try to promote that among community members and show support of those businesses trying to stay open for us. So Roxy's, Country Market, as well as Hungry Moose are all continuing to serve us, and we can't thank them enough that we don't have to make the drive to Bozeman to get our much needed food and other supplies. With respect to the lodging partners, the forced closure of Big Sky Resort on Monday, March 16th was quite traumatic for our destination. That was followed by the lodge at Big Sky closing on March 22nd, which is when the resort's lodging fully closed. That cascaded into Lone Mountain Ranch closing. And so really we're looking at a lot of our property managed companies still having units available, in addition to the Wilson Residence Inn by Marriott and Rainbow Ranch. However, it is pretty minimal, around 10% in occupancy. And as we look into April and May, that's not really coming up from that. I would put a caveat that this is our shoulder season. As the resort would have closed on April 19th, we do see visitation in the month of May and really until the first week of June, not anywhere near rival where we are during the winter. The park, Yellowstone National Park itself, has closed for an unforeseeable time frame, and we are tracking that very closely as well. The normal timeline on them reopening is April 17th with some bike access and then vehicular traffic as we lead into summer. And so we're hoping that some normalcy will be established there on that timeline of reopening, because we do see roughly 30% of our visitors to Big Sky do make trips to Yellowstone Park.
Gotcha.
The largest segment really impacted for early spring is that May month, and that is our international group travel, that Asian traveler. My motor coach partners, for example, Carr Stage, have been just dealt a blow like you would not believe. And some of the more traditional lodging partners, like the Lodge at Big Sky, as well as previously Bucks, had a lot of foundational business of spring and leading into summer with that segment. So that has just completely gone away.
Yeah. One last question, and I'll throw it over to Joe. Has the Chamber and Visit Big Sky begun to develop any campaigns or special plans to help put some gas back in the tank come summertime, or when we project that we might be able to?
Absolutely. Yes, because we are going to have to hit that go button. So National Travel and Tourism Week is May 3rd through the 9th. And that's a time when nationally across the country, we all band together to just try to help individuals understand the importance and the impact of the visitor economy on their lives. And I think, unfortunately, it's being demonstrated right now in a not so positive way. So we, in light of that, are hoping to convene the community on May 8th, which normally has been our annual marketing outlook luncheon, to talk about or have more plans of what we feel we will be doing moving forward. The Montana Office of Tourism Business Development, our Yellowstone Country Tourism Region, and our fellow 6 CVBs that are Belgrade, Bozeman, Livingston, Gardner, West Yellowstone, ourselves, are all working together, most likely going to be putting out co-op programs so that our dollars that we do have, which are going to be dramatically impacted downward with lack of bed tax collections, as well as lack of resort tax collections, from the lack of lodging, to pool those monies so that we have bigger bang for our buck to bring people back to our region.
Excellent. That's
appreciated. Eric, one last thing, is I have had numerous people ask me, are we continuing to market right now? And we're not. The messaging that we are putting out is visit Big Sky later, come live the dream, but keep the dream alive for future travel plans. And National Travel and Tourism Week had been focused on the fact that tourism matters. However, the theme is being changed in light of COVID-19 and will be unveiled here in the next week. So we'll be sure to share that information too, so that everyone can support that effort.
Excellent. All right. Thank you. Joe, anything from your end?
Yeah, we do have a couple questions coming in. I've got a few myself, but this one comes from Joe. Not this Joe, different Joe. With video communication, Candace, being so critical, in the worldwide right now, are there any discussions on getting quicker bandwidth or 5G in Big Sky? Any information that you can share?
Sure. The Big Sky Chamber actually in its FY20 allocation received monies for a telecommunications study. That task force that was put together to address that issue identified our cell service is actually a much greater need than our fiber. Three Rivers, and as our internet provider, has been a terrific partner in that process. However, really cell service is a confusing issue that people don't recognize. It's not necessarily the fiber, it's the cell. And we are working with a provider on giving us a study back related to that to hopefully augment that service moving forward. I have seen some talk on the national level as well in how this has really pointed out the shortcomings in the rural broadband network across the United States. And it does look like that there are some agencies that are working to get some funding for that in light of what we're seeing going on here, that these GoToMeeting, Zoom, Skype, et cetera, that there has been some negative impact with respect to the networks not being able to handle all the traffic on them.
Got it. Thank you. Last one here. There are a number of reports that people from cities are locating to mountain towns, and a number of these mountain towns in the West are essentially shutting their doors to outside visitation at this time. Are there any talks of limitations going forward in Big Sky, or any evidence that that could happen?
There aren't any talks locally. I have seen a handful of articles, as you mentioned. The New York Times ran some locally in the state of Montana. I actually spoke to two different reporters today related to, are people fleeing to Montana and to Big Sky? And the answer is no, they're not. In reaching out to my property management companies today, or over the last 3 days, actually, what we're seeing is we have some owners who have come to stay in their units, but not a huge amount, like a handful roughly. We have a few sets of guests who arrived before the March 16th, kind of when the switch was flipped, who have decided to extend their stays due to travel restrictions. But really our occupancies are very, very low. I did just see that our governor just announced that anyone coming in from another county or another state will have to self-quarantine for 14 days. So I'm sure that's going to have an impact in disincentivizing any travel. But at the moment, no, we have no discussion of saying, if you were coming, you can't come. So
got it. Well, thanks so much, Candace. Appreciate that. Back to you, Eric.
Thank you, Candace.
Thank you.
Appreciate everything you guys are doing at both those entities. Next up, we have Gary Rieschel. This is to bring us a little more worldly outlook on what we're dealing with, and we're very fortunate and lucky to have Gary in our wheelhouse to be able to have someone like this on our panel today. We did do a podcast with Gary last week. I'd encourage you to listen to that. That is on explorebigsky.com. Gary's a leading healthcare industry venture capitalist. He's also founding managing partner of Qiming Venture Capitals in China. And he has a home here in Big Sky and has been part of this community for a long time. So Gary, thank you for joining us today. Yeah,
my pleasure, Eric.
Gary, if I could start, and I did ask this question a week ago, and I'd be curious on kind of how it's changed in a week. How would you see that, and how would you kind of describe the current state of COVID in the United States, but also in Montana?
So I think everyone has access to a lot of information about the spread in the U.S. and the various cities that are struggling. We haven't seen a great flattening of the curve in many places. The state of Washington actually appears to be, entering that phase, at least from some early data, but New York clearly has not yet, and California, it's iffy as to whether or not that will happen. It's interesting because we have a lot of staff in China, and we have a lot of a lot of companies that do healthcare investing in China. And when you talk to them, what China did early on was by taking 60 million people and saying, you can't leave this particular area, no one can go into this particular area. They really reduced the overall exposure in the country to to the virus. Now, whether or not they have a second wave, that's all to be determined. But they were very effective early on by an extremely strict quarantine. At this point in China, if you fly to Beijing, you will not be able to do anything for 14 to 17 days from the time you get on the plane until you complete your quarantine in Beijing. Same thing for Shanghai. And so those are steps that the United States has not yet taken. So I think the U.S. has remained relatively open with people traveling between states, between cities. You see some of the examples where people have probably been overdoing that a little bit. But so I think it's too early to say that we're anywhere near flattening the curve in the U.S. For Montana, I was just on the phone with Senator Daines, and he mentioned we've had a couple deaths up in the Libby area, people with compromised lungs from the mining and things in that region. So he's doing some fantastic work in terms of actually heading up the Senate efforts on next generation diagnostics, next generation therapeutics, vaccines, and so on. So Montana doesn't appear, at least to me, to be anywhere near the forefront of discussions. Right now, it was China initially. You look at what's happened in Italy, you look at what's happened in the United States. We still don't know the exact vectors on how this has been transmitted. So there's still an awful lot of learning to be done. One thing I would just highlight for folks, if you look at the response, this has really been in the system for, let's say, 3 months, January, February, and March. If you look at what happened during the financial crisis or some other significant events, the 2000 .com crash, it literally took 8 to 12 months from the time that you knew there was a problem until the time that you actually saw solutions being propagated in the market. This is actually happening much quicker. No government wants to deliver bad news to its people. So China certainly could have done some things earlier. The US could have done some things earlier. But when you look at the collective responses now, they're actually coming awfully fast. And a great deal of work and energy is being put towards this. Unfortunately, this is not something where you have a quick solution, or you have a 6 month, in 6 months from now, we'll have a vaccine, and so there'll be a cure, if you will. Consider that. So the timeframes don't work in our favor, but the response has actually been quite rapid.
Right. Well, I appreciate that insight. Switching gears, Gary, I'd like to say you're one of the smartest guys I know, especially when it comes to small business, and you've seen a lot of businesses succeed or fail over the years. If you were to be given some advice to the small business owners of Big Sky, what would you tell them right now? So
most small businesses don't really have what I'd call sophisticated planning when you look at, you especially seasonal businesses. So you have enough cash and you kind of manage the business on a month by month or quarter by quarter basis. This is going to be a very difficult time to do that. The reason I would say that is, yes, you're in the shoulder season, but this last month leading up to the middle to end of April is really where a lot of businesses put cash aside for May and June until the summer season picked up. There's a significant chance the summer season won't really pick up. Let's be optimistic that it will, but it may not pick up until July or August. The danger with this bug is without a vaccine in the fall, and there is no chance that there'll be a vaccine in the fall, is that you start to have outbreaks in the end of September, October timeframe, coincident with the flu season, and you wind up with another very, very rapid response appropriately to avert the spread of the virus. What that'll do is that'll put all these small businesses exactly back in the same situation they are now, with 2 to 3 months of uncertainty in a shoulder season heading into the winter timeframe. So I think you need to ask your friends, you need to ask, whoever you can get a hold of, what's the right way to plan your way through this? How do we think about what kind of tools can we make available? So it's one thing to provide people cash. It's something else to provide people tools to where they can actually look realistically at their business and where they're going to be in both 3 months and 6 months. And what would the contingency planning be? I mean, the government's going to do some of that, but I think as a community, there's a great deal of that we can do together.
Excellent. Well, I appreciate that. That's very good advice. Switching back to China, you've obviously got an inside track and knowledge on China with some of your businesses over there and some of the investments. What are you seeing any meaningful breakthroughs happen there? I know some of your companies have actually had some recent breakthroughs with some ventilator success and some cooperation with Italy, and anything that's worth sharing to the audience that can kind of bring some hope to the situation.
Well, I think that what you're in a situation now is it's all hands on deck. So the companies that have the technical capability to assist in this, I think everyone is actually trying to do that. But again, you need to separate the ability to diagnose whether someone is sick or has been exposed to COVID virus. You need to separate that from the ability to treat that, which would be a therapeutic. So you have the diagnostic tools have come very fast. So they're imaging diagnostic tools, 5 minutes, you can do a CT scan, look at your lung and know whether or not you have any virus exposure to your lung. So that's something that's been developed in the last 3 to 4 months. The other diagnostics tools that have been released all are getting fast-tracked by the FDA. So the FDA has stepped up and said, we're eliminating any artificial barriers to getting these into the marketplace. The second phase are the therapeutics. So those are the companies that treat the people that are sick. And we are going to see a number of things approved for that treatment over the course of the next 3, 6, 9, 12 months. The holy grail for these kind of viral infections, though, is a vaccine. And the vaccine process, the absolute earliest you can have a vaccine is Q1 of 2021. What that means is there will not be a vaccine in China or anywhere else in the world for September, October, November, December. So the beginning of the flu season, the beginning of the COVID virus, if it comes back in the fall, and it's somewhat endemic in the system now, so it is probably going to come back in some form in the fall, you will not be able to have a vaccine during that period of time. There's simply not a process that exists to have a safe, tested vaccine in the market during that period.
Okay. Well, that's good, honest truth. So I appreciate that. To steal one from your playbook, you asked me this question right once, and I'm going to ask it back. What is something that you find interesting right now regarding the COVID crisis, and and also maybe looking into the future? What's something that you find interesting in thinking about what this might turn our country or economy into?
So what we're spending quite a bit of time looking at now is the real repercussions for this are not during this period of time. The real repercussions are going to be that 12, 18, 36-month period of time. If you look at what we've just done, we've taken the entire U.S. school system, whether you're a kindergarten student or a university student, and we've put it through the beta test of online education. It will not go back to being the same. So the education system is fundamentally going to change. If you look at working from home, you look at this kind of video conference, there used to be somewhat of a stigma about people who work from home. Well, inside some very large software companies in the Pacific Northwest, they've already productivity is up 25 to 30% by people working from home.
Wow.
So what's happening is people actually are taking this very seriously. They're actually being very productive. So 12, 18, 24 months from now, that also will not change. So corporations are going to look again at who do you need to have in an office? Who can work from home? These are changes that were occurring at very slow rates, but this has just been a huge accelerator on those two factors. The downside to that is, a lot of corporations aren't going to need as much space. We're going to think about our life, our daily life activities differently as a result of this, because you've had a chance to try something that in the past maybe wasn't seen as, maybe you didn't think it was so professional to work from home, or it was something that, again, there was some stigma associated with some of it. All that's gone. So I think those changes are going to stay with us for a very long time.
Excellent. Yeah, That is interesting. That is very interesting. Joe, you have some follow-up questions?
Yeah, I do. Hi, Gary. Good chatting with you again. As Eric mentioned, he and I interviewed you for a podcast on March 19th. Feels like months ago at this stage. But I wanted to ask you, what have been the most noticeable changes from where we were 11 days ago to where we are now?
So I think that again, we've gone from being the U.S. has gone from being maybe a little too optimistic about when you could get back to whatever you want to call normal. So I think now saying end of April as opposed to middle of April, that is a more realistic time frame. Things are not going to be good at the end of April. I mean, Eric referenced the IMAG organization out of Seattle. They're the world's experts on mortality. They think you're going to have peak mortality in the April timeframe, but that doesn't mean that you're not going to be having significant new cases of this into the May timeframe. So I think that anyone who's been optimistic about this has been wrong. And I think that going back 11 days ago to today, I think the realistic point of view is we still don't know. We still don't know, can a child that has been exposed but is not symptomatic, can they transmit this to a teacher? There's so many things about how this bug actually gets transmitted. The cruise ship, they found the bug was alive on the cruise ship. The COVID virus was alive in the cruise 17 days after they cleaned the ship. So there's a series of things about this that we are still learning. So the good news is the response has been very quick, but the response is coming at the time where we're still coming up a very steep learning curve. So again, I would say if you think you have a 30-day problem, you probably have a 60-day problem or a 90-day problem. So don't be optimistic as to when we're going to come out of this. I'm an optimistic person. I mean, my entire life is investing in startups, and so by definition we're optimists in venture capital. But I think this is one where, for your own personal planning as an individual, a small business, don't be optimistic.
Understood. Thank you for that. We have a question from Paige from the audience. Do you think this will increase Made in America pharmaceuticals as well as other products?
So there's a great deal of discussion on supply chain relocation in the U.S. There was a lot of it because of the trade talks, prior to this. And again, this is a bit of an accelerator. One example, though, in terms of how difficult that is, there's a series of products called reagents, which are the fundamental building blocks of pharmaceutical products. If you said today you wanted to no longer depend on China or India, which are the two largest importers to the U.S., for reagents, it would be 7 years before you could have approved reagents manufactured in the United States that could go into pharmaceutical products. Wow. And that's what it takes to do the testing, build you're building the facilities. So manufacturing is not about just the product, the entire process, what you have to do from a regulatory standpoint and anything associated with pharmaceuticals. The timeframes are not in our favor. Now, you will absolutely see coming out of this strategic initiative to say we should not be dependent upon this country, we should not be dependent upon that country. It's almost, I hate to use this as an example, but every time there's a shooting, every time there's a crisis, there's this overwhelming response that then runs into the reality of what it actually takes to make progress. I think a lot of the talk about supply chain rehosting is being done by people who frankly have never built a supply chain somewhere. And when they go and actually face the reality of that, they'll realize it's very difficult.
Yeah, sure thing. We have one last one from Bella. What lessons can we take from this pandemic to better reinforce our global economic and social systems post-crisis?
That'll be actually where all the political leadership in the world is going to have to spend a great deal of time. Two things expose weaknesses in systems. One are tragedies or things like a viral infection. The other is technology. because technology exists to disrupt whatever an existing system looks like. So here you have a perfect storm of the virus comes in and turns a lot of people's lives, a lot of our lives collectively upside down. Technology is sitting there saying, well, we can solve this problem, but we're going to solve it in a way that it hasn't been done before. It's not going to go back to being the way it was. So what I think you're going to have to see is leadership. The leadership has to take a look and say, don't pretend that you can go back and just make things the way they were. One of the most disturbing, if you think about financial impact, the Economist Intelligence Unit today published their GDP forecast for the world. The 20 top countries in the world will lose about $5 trillion of production this year. That's the top 20. And those countries are rich enough that they can actually afford to do things like a $2 trillion package to support the economy. Mm-hmm. The other 180 countries in the world don't have those resources.
Sure.
So fundamentally, this is going to be something that almost all of our systems will either have been affected by the virus or by the technology that's a solution to the virus. And I think the leadership is going to have to be much more aware of those trends in order to solve these problems.
Sure. One last, just briefly, I wanted to just, you mentioned the $2 trillion aid package. I was just curious about your initial take on that.
Well, it's a lot of money. It's not enough money. Mm. And so the right way to think about that is the idea of sending a check to everyone. I think, there's a lot of people who shouldn't get checks, and hopefully they'll be very, very selective in terms of who gets that money. But the idea is, what you really don't want to lose is your job. I mean, it's one thing to not be paid for a week. It's something else to have this uncertainty with all these small and medium-sized businesses where they just don't know who they can employ over the next 3, 6, 9, 12 months. So I think what will happen over time is we will revisit this multiple times as it comes down to how do you guarantee or how do you facilitate employment. Mm-hmm. And I think that $2 trillion is a huge number. It's the largest aid package ever put together by the U.S. government, anyone in the world. It's not going to be enough money.
Wow. Well, thanks for that insight. Much appreciated. Eric, anything from you?
No, and I just want to remind all the listeners, and we've got quite a group following us out there. Thank you for joining us. Please continue to submit questions at the end of this. If there's something that Candace or Gary or Taylor that you'd like to ask questions back to, we'll make sure that we have time to do a follow-up question at the end. But thank you once again, Gary. I really appreciate that. Next up, we've got Loren Bough, longtime Big Sky local. He is the vice president of the Yellowstone Club Community Foundation, which helped establish the fund called Big Sky Relief Fund. And he also sits as the chair of the Big Sky School District. Loren, thank you for joining us today.
Thank you, Eric.
Excellent. I'd like to kind of cover two different segments today. We'll start with the Big Sky Relief Fund, and then we'll maybe close with the Big Sky School District, both of which are integral parts. And can you describe a little bit to the audience on how the Big Sky Relief Fund came to be and the intention of the fund?
Sure. The Big Sky Relief Fund it's simply the idea that our community, if we rally together, we're stronger together. And there's been some great leadership from the Resort Tax Board with Kevin Germain, and also with Spanish Peaks Community Foundation, John Haas, Moonlight Community Foundation with Heather and Anya and Larry Landry, and then the Yellowstone Club Community Foundation. We just think it's going to be a lot easier for our community if there's one website that has one place for applications, one place to make donations, and one place to collect information.
Excellent. Are funds available now? And if so, how do folks apply and who qualifies?
Is that coming through?
All right. I think we got you back there, Loren.
Sorry, did I disappear?
That's all right. We just had a little glitch in the matrix there. Are funds available now, and how do folks apply and who qualifies?
Sure. So I think that, listen, we've got really two fundamental goals with Big Sky Relief. One is we have a great medical system here in the community, and how can we support it and make it better? And that's one of the things we've done. We've purchased ventilators, we've expanded rooms. We even just can announce right now that we've got a partnership with Sims, where Sims is going to make surgical gowns for Bozeman Health. You can't buy them anymore, and they're going to make reusable ones. And that's a fantastic partnership we have going. Second thing is we're just helping individual families who suffered a loss. We want to keep these families and these individuals living here in Big Sky. Monies are available. We go live with the website tomorrow. We've raised over $1 million for Big Sky Relief, just that will be available for the individuals and families. There's another $1 million that'll be available primarily to help the medical center, primarily to make sure that we can offer as much medical care and support our medical heroes in the community with the funds they need.
Excellent. Does the fund need more support? And if so, how can people bring support to you?
Sure. Well, let's try and see if the technology works here. But if you go to this website, I hope everyone can see that. Right on there, that's the main landing page. There's a donate portion. You see we're set up, we're live to go. You can make a donation, anybody in the community can. And there's also a request funds site, which is listed on top. So again, we intend to go live with all of that tomorrow. And people, those applications will be reviewed probably in the next 2 weeks. Again, tremendous pulling together of leadership, that we've got an advisory board that will make those grants, and they come from Resort Tax, from Moonlight Community Foundation, from Yellowstone Club, and also from Spanish Peaks.
Excellent. Well, that's a great kickstart to that. And that recent survey that we did at Explore Big Sky, it's the respondents said that 76% of them were concerned about mental health. Can you talk about a little bit about your group's approach to this, or how it's being addressed from the community's standpoint?
Sure, thank you, Eric. We are very concerned about mental health. We're concerned. Mental health was a focus for the community a month ago, which now seems like almost a year ago in terms of what we've been through. And we think it'll be worse as people lose their jobs, as they're forced to stay home. There's more family stress, and there's more stress on the individuals. So we've dedicated some line items, at least $100,000 towards how can we improve mental health, kind of right now. And I know that there's been some progress on that through WIA and with some of the Resort Tax dollars, but we think that there'll be more funds needed. Effectively that means bringing counselors to Big Sky, and that might be the same way we're doing it here on Zoom or telemedicine. So that won't necessarily be a specific part of the application, but we think we have funds available for our partners in the community. One aspect of this is funding, getting money to individuals to keep them in the community. The other aspect of Big Sky Relief is getting money to the other 501c3s that are doing this kind of work in the community. So we definitely will focus on their needs.
Excellent. For those that want to get involved but might not be able to make a financial contribution, is there a volunteer need in the community, or how is that effort going to be organized?
Yeah, the volunteer effort's being organized on that same website, bigskyrelief.org. You can go there, and if you have needs, you can make a request. But if you have time to volunteer, that'll be the home site for making those connections.
Excellent. Joe, why don't I jump over to you? If you've got, maybe we'll stay on Big Sky Relief now, and then we'll jump to the school after that. Joe, you're muted. Okay. Loren, maybe oh, there we go.
All right, here we go. Sorry about that. We understand, through the Big Sky Relief effort, the effort you all are putting forth, and it's very much appreciated as a community. What can we as a community do to ensure that our nonprofits survive? Such an essential part of the community as a whole. Anything that you would suggest that those entities can do?
Well, I think one of the things we can do is that we're planning for the long term here. I mean, this is we've got well over $1 million we've already allocated to this, and we're going to be responsive to those organizations in need. We expect that there'll be some reduced funding for 501c3s as a result of people putting dollars towards the medical needs of the community. So we intend to be receptive to that. I think one of the things we can do is, as Gary mentioned earlier, when we have conversations with our representatives, with Senator Daines or the other people who are engaging with the community, the 501c3s are left out on some of the unemployment benefits. They've been left out on some of the other criteria that where there's federal support. And so, I think just highlighting those issues so that we can keep them healthy is probably the best we can do right now.
Gotcha. Well, thanks for that. Eric, did you want to touch on some school questions or like?
Absolutely, Loren. How is the school district doing right now, with the switch to online? Maybe, give some of the viewers some highlights on how the district's holding up and the teachers, and are there any needs out there?
Sure. Thank you. We are super fortunate. The Big Sky School District, we're now in our third week of virtual classroom. The virtual classroom means the students are, attendance is being taken at 8:30 in the morning and they're released from their virtual classrooms at 3:30. We're probably the only school in the state, the only public school in the state to have accomplished that in that first 48-hour period. So as Gary mentioned earlier, education is going to change as a result of this. One of the surprises, we were actually seeing somewhat higher attendance. We're seeing fewer kids not participating. We're well over 90% participation. It's a trial and error. We're now week 3. There's a little bit more monotony for some of the students. We're going to try and be a little bit more creative about some of the platforms that we use to deliver it to the students. But it's probably been the biggest bright spot of the community, is the way that the school has been able to step in. We're getting a lot of very encouraging words from parents who are just pleased that their kids feel like they have a purpose. They're on track for graduation. They're on track for, it might be a virtual graduation, but they're on track to earn their diploma, and they're on track to make the necessary progress for advancement in the school years. We do have some technology needs. I think we've been lucky. Three Rivers has agreed to increase the Wi-Fi speed for any family who needs it. We've been practicing this for 5 years, going one-to-one with devices. So every child in the school has a device at home that they can use. That makes us very fortunate compared to the other districts in Montana. But we're looking at probably some technology needs to boost our capacity.
Excellent. Well, congratulations on getting everybody online in 48 hours. I've heard some great feedback. And how are the teachers holding up?
Teachers are holding up okay. I think it's been a bit of a challenge for them as well to not be able to see the student interactions with the same immediacy they have in the classroom. But as Gary mentioned, this is the future. More and more platform delivery, online virtual delivery is the way of the future. So while there's some adjustment processes, I think they're kind of proud that they were able to do it as quickly as they have, and they really feel that they're the cutting edge of education. We've gone out to the rest of the state and offered to kind of do some virtual lab for other schools to show them what we find is working and what's not working. And, I think that gives them a good sense of ownership and empowerment about how education is moving forward here in the state of Montana and globally. Excellent.
Well, thank you once again, Loren. Appreciate all the great work with the Big Sky relief effort. That was awesome to see that come up so quickly. And once again, thank you for all your work with the school as well. So thank you for coming here today.
Just want to end with a big thank you to Spanish Peaks, Moonlight, Community Foundations. They've really been great about stepping up and getting dollars into Big Sky Relief.
Excellent. Yeah, and to remind everybody, that seed capital for Big Sky Relief did come from Yellowstone Cloud, Moonlight, and Spanish Peaks, as well as the Resort Tax District. So that was a huge jump start to that. So thank you, Loren.
Hey, Eric. I've got one more question here that I think is interesting from our audience. If I could jump in real quick. Loren, I was wondering if you could explain if and how the Big Sky Relief Funds are going to be made available to businesses as well as individual families.
Sure. So, as an operating, functioning business, a lot of that will be directed towards Candace. When we look at the organizations we're going to help, it'll primarily be the 501c3s. Now, there's a distinction there. If you're the owner of a business and the business is really suffering, I think we're going to qualify you as an individual and find a way to make that work. And all of that kind of information will be live on the website tomorrow, in terms of the kind of the criteria that you need to meet to apply. But yeah, there'll be a crossover there on individuals and businesses.
Got it. Got it. Great. Well, thanks again for your time, Loren. Appreciate it.
Excellent. And once again, people remember to submit questions. If you think of something in the next little bit here, we can bring Loren back at the end. There's certainly some important efforts that he's working on and representing. Next up, we have Whitney Williams to kind of bring a more regional and state outlook to what's going on, and grateful to have Whitney with us. She is CEO of a company called Williams Works. She's worked alongside Fortune 500 companies, charities, and to help solve complex problems, including working with companies during disaster times and pandemics, similar to what we're experiencing now. Whitney's also running for governor for the state of Montana, so she brings us a kind of a middle of the campaign pause and moment. So thank you for taking some time, Whitney, to join us today.
Sure. Thanks, Eric.
Wonderful. Whitney, you've traveled across the state, and now you're having to do it a little more virtually for your campaign and talk to people in every corner of our state. What's your read on how Montana's coping with COVID and how the state's faring so far?
Yeah, thanks, Eric. Well, I so appreciate everyone being on, and I've learned a lot in the last 45 minutes. So thank you, everybody. Hey, look, I mean, I think everybody has said a version of this, but Montanans are really strong and resilient. And this is an unparalleled moment, no question about it. But I think folks are optimistic. I think people have been, we've been doing a bunch of sort of virtual town halls. So talking with people sort of every day like this and in different settings. I think folks are worried now about the things they were worried about when I first got in this race 6 months ago. They're worried about affordable housing. They're worried about the high price of pharmaceuticals. They're worried about healthcare in general. We talked a little bit about broadband and cellular. I think that this, crisis has really unearthed a lot of the inequities and a lot of the challenges in this state that needed tending to before and certainly do now. So if there's a silver lining, I think at least it's showing us what some of those are. But look, I think folks are, feeling extremely grateful, without question. I think everyone has, felt this great deal of gratitude toward neighbors. There's just this beautiful spirit that exists, I think, in all of us here in Montana, that sort of willingness to pull each other out of a ditch or, wave from behind the wheel. None of that's changed. And I think that reality of neighbors helping neighbors is coming out in full force right now. So that makes me very optimistic. While there's, certainly tremendous challenges, and we can talk about more, today or another time about what some of those are. But I do think folks are pretty optimistic that we're going to come through this, but that it's going to be tough, and it's going to take all of us, and it's going to take some new ideas and new leadership and new approaches, and a lot of relationships, certainly with the federal government and the private sector, to get back on track.
Wonderful. Yeah, absolutely. Well, if we live through -30, we have to be resilient. So you've consulted businesses and lived through other, pandemics. I wouldn't say on the same level as this, obviously, but some pretty substantial ones. What consulting would you give to small business owners or people that are, have that fear in coming into this next quarter or year that we're facing?
Yeah, I have. I work a lot in the developing world. So a lot of where the sort of bottom billion, they call those folks who are living on sort of $1 a day, live. And after people who've been sort of struck by, hurricane or disease or some kind of, drought, et cetera, it's tough to rebuild from those things, but it is possible. And I think for small businesses, of which I am one, my business is also, feeling the effects and impact of this as well as everyone else's. I think we just need to do what we can to both be in touch very regularly with local, state, and sort of federal resources to see what can be made available. I will say to Loren, one of the things on the nonprofit side, I work extensively with nonprofits as well as, just making sure that you guys have done such a good job just doing exactly what you're doing and communicating well with people about what types of resources are available, and then continuing to raise them from other pockets if we can find them, to bring people together to make sure that we, again, solve for what's going to be the sort of short, medium, and long term. This is going to be a difficult road for sure, but I think working together and bringing together new ideas and new approaches and new, bringing everyone around the table to make sure that we problem solve our way through this is the way we've always done things. And I think it's the way we're going to continue to. We just need now to move with, a little bit more urgency on some of these issues in the short term, I think.
Absolutely. People listening to this town hall, and once again, you're kind of, being able to bounce around the state and have a state perspective on it. Do you have any advice for if people want to get more involved in the recovery effort outside of our community? Are there pockets of needs that you see out there or ways that you might suggest them getting involved?
Yeah, I think there are a number of ways. And I think certainly, as Loren mentioned, the foundation and the nonprofits there locally, but the state has a community foundation as well that I think has done a really good job at sort of starting to capture the variety of needs from, food banks to everything, educational resources, resources for seniors, resources in housing sector. I think the Montana Community Foundation has also done a really nice job at sort of trying to aggregate some of that information. So I hope that folks can look there as well. And we can also, Eric, post some other resources. I think that Governor Bullock, has done a really good job at sort of pulling together what is in a very difficult moment. And I think they've also got some good resources to drive people and direct people who want to do more or want to help.
Excellent. Well, and then that'd be great. And we'd love to share that on our platform with everybody listening today.
Yeah,
I think there's certainly, a lot of communities in Montana that don't have the resources that Big Sky has. And I think that it's a lot of people in our community, we've heard it's our job to be a good neighbor and make sure that we're helping out the balance of the state that might not be in the same position that we are.
Yeah, totally, Eric. I appreciate you saying that. I think we were in the middle of a 56 county tour on my campaign when this happened, and we were spending lots of time in very rural communities and small towns across the state, including in really far eastern Montana, where my lieutenant governor candidate Buzz Matlin is from, and Roosevelt County and Culbertson is where he comes from. And you look over there and sort of start to see what's happened with sort of communities, these rural communities whose schools may be closing altogether, or they may, like in Sydney, be going from a 5-day school week to a 4-day school week already before any of this happened. And so I appreciate you sort of calling out to some of the communities that, just don't have resources and already were really hard hit from, the tariffs, from, the difficulty of, being able to sell their crops from all these sort of farms and ranches being locked up off, in communities across the state. So there's a lot of need and a lot of challenges and a lot of ways to help neighbors who don't live next door.
Absolutely. And the last question before I hand it over to Joe. Obviously this COVID situation hit right in the middle of everyone's campaign, including yours. How has this affected the campaign process, and how are you seeing you and the people that you're running against or with? How is everyone adjusting to this campaign process during this time?
Yeah, well, I think that we are all in the same boat in many ways, and that we can't sort of knock on doors, which is what we were doing, and meet in living rooms in the way that, you want to do when you're trying to serve the people. And so I think that's made it more complicated. I love that part of the work most, is just meeting Montanans and hearing what's on folks' minds and getting ideas from people. And so that's changed. We've just taken it online. So I think not unlike some of the other campaigns, we're just doing, virtual town halls and as many kind of community meetings as we can do, so we can still continue to hear from folks. And this platform, Zoom and Facebook have worked, I think, really well, again, for all of us, whether I happen to be a Democrat, but our Republican friends, I think, are doing the same thing. And, we'll just keep at it. We have every belief that we're probably not going to be able to campaign in the way that we were intending to. And so you just pivot, which is what you do when you're a business person, like most of the people on this phone, and like Montanans, we figure it out. So it's made things a little more complicated in some regards, but it's also been really nice. Like, I'm just looking out at everyone's faces now. When you do have a few weeks where you're not connecting live with people, it's really nice to be able to do so online. And so people have been signing up to do that, which we really, really appreciate.
Excellent. Joe, anything from the audience?
Yeah, I've got a question here. Whitney, thanks again for joining us on this town hall. I really appreciate your time. You mentioned rural communities and the needs that they have. What is being done and what should be done at a statewide level in regards to online digital education and those tools required for rural schools and teachers?
Yeah, well, I mean, let's just start with, I forget who it was, Candace maybe, who was talking about broadband and cellular, both fiber and cell. We have got, I mean, again, pre-COVID, we've been talking about moving with urgency into, sort of a future where 30% of Montanans who are currently underserved can get served. I mean, come on, we're the United States of America. We live in Montana, for goodness sake. We should all be able to communicate. And hasn't this sort of crisis uncovered what's actually happening here, which is a lot of folks who now need to do, schooling can't, but they can't reliably because they don't have access. And I believe infrastructure, just like certain work gets supported by the state and state dollars because it is infrastructure, it's critical infrastructure. We would all agree with that. I happen to believe broadband is as well. And I think we need to start including it as a state in infrastructure. And now, again, I think maybe we have a moment because folks are seeing how critically important it is that everybody be connected. We just need to make sure that we get that done. And that's one of those things I think Montanans agree with. I think they understand how centrally important it is to sort of our day-to-day and to our future. And so hopefully, we can get that done.
Mm-hmm. Yeah, broadband's definitely an important component of that. Do you feel like a lot of these rural schools are equipped equipment-wise, tools-wise, computers?
No, they're not.
Mm-hmm.
They're not. And we've got to help them both with, assets, hardware, but broadband as well.
Got it. Just give me 1 second here.
Sure.
So, yeah. So, you're a sixth generation Montanan. I'd like to hear just your thoughts about what you know about the people of Montana in times of crisis, and what has surprised you about this particular virus and the response of Montanans?
Yeah, my family came here during the gold rush. My mom's family did, and then my dad's family immigrated here. We all got here how we got here. My family, happened to be some of the early settlers in Montana. And, I think that sort of idea, I think about my great grandma coming through Yellowstone, what is now Yellowstone Park, in a covered wagon, and thinking about all these families, like so many of you, who homesteaded, and that sort of grit and toughness that it takes to do that in the first place. Certainly, I feel lucky that got passed down those generations to me. But I think it is, what I said at the beginning about that sort of idea that, you don't ever see just one car on the side of the road in Montana, right? You always see two because someone stopped to pull a neighbor out of a ditch. And I just think it's our willingness to connect with and support community and our neighbors that makes this place really special, and maybe makes, is the reason that we are all here in many ways. It's that sort of waving from behind the wheel. I mean, we all have, friends, we've all traveled to other places that are not Montana, and you see how that's just not the case. And that lovely spirit and attitude of, togetherness and working together that makes us Montanans. We know we don't build a barn or a fence on our own out here. So I think that spirit is alive and well in this state. And I mean, it's one of the things that makes me very proud to be a Montanan. And I think that that's exactly the same spirit that's going to get us through this, by helping our neighbors and helping small businesses. I mean, look at all of the people, and I hope this can continue to happen, who are, buying gift cards from local businesses, who are doing everything they can for elderly neighbors, who are showing up at the food banks in Missoula, where I am, or, wherever you all might be. I think there is an outpouring of support, and it's not going to be easy. We're going to need a lot of support from each other, and we're going to need a lot of support continued support from the federal government and from businesses and innovators across the globe to get through this, but I think we will.
Yeah, yep, a lot of resilience in this state and in the people. Well, thank you, Whitney, really very much appreciate that.
Thank you, Whitney. Wonderful. Bringing it back local for our last Q&A, we've got members of the Big Sky Resort Area Tax District. We've got Kevin Germain, who's the chair of the Big Sky Resort Tax Board, and Danny Burschwald, the executive director. So we'll be fielding questions to both them and appreciate them kind of rounding out our Q&A here. So I'll start out with the first questions. What are some current projects that Resort Tax Board is working on in regards to this COVID situation?
Great, Eric. Really appreciate you convening this group tonight. It's been educational to listen in, and I'm happy to be a participant. Real quickly, I would love to give a big shout out to the Resort Tax Board. We have an all-volunteer board that has really, in my opinion, risen to the occasion and been working a lot of hours on this. You have Sarah Black, Buzz Davis, Steve Johnson, and Sierra Wolf. So really thanks to our volunteer board. And even bigger thanks out to our staff. You're going to hear in a minute from Danny Burschwald. Danny has been working 7 days a week nonstop on this for about 3 weeks. We got Jenny Mescat, Kristen Drain, Sarah Huger, and just thankfully on loan to us from Outlaw, Mike Summerby helping us on communication. So there's a great team effort going on behind the scenes. Your question about what's Resort Tax Board doing in response to COVID-19? You know, the first thing as a board, we needed to look after the safety of our team. So obviously we had a very easy transition to online and closing the office from a public standpoint. So I really wanted to take care of our team. Then we quickly transitioned to, you know, what tools does the Resort Tax Board have to help the Big Sky community during the COVID-19 pandemic? And I'd say it falls into two buckets. The first is financially, and the second is coordination and communication. I'll talk about what we've been doing on the financial end, and Danny will talk a little bit on the coordination and communication. So on Saturday the 14th, we got a hold of our legal counsel. Danny and I had a long day with her on Saturday to figure out what could the Resort Tax Board legally do. I think everybody in this community is used to the typical procedure that every prior Resort Tax Board has done, which they haven't dealt with the pandemic, which is we collect money all year round. We go for a call for applications in April and May, and we allocate those funds in June. Well, we got our legal counsel working immediately, trying to give us a good legal opinion. What flexibility do we have with the funds that we've collected to date? And so luckily, our counsel told us that we have quite a bit of flexibility with the funds that we've already accrued. The second thing that we did on the financial front is Danny sent out an email on Sunday the 15th to everybody who received funds for fiscal year 2020. And there was about $3.4 million of funds that had been allocated that wasn't spent. There were really two questions that we asked all the applicants. The first is, what are your needs right now in COVID-19? What should Resort Tax and the community be aware of that would help you through COVID? And specifically, how are you adapting and evolving to help this community during COVID? So we asked that question. The second question was, what of the funds that we've already allocated with you can you deem non-essential and commit to return back to Resort Tax to be reallocated out to the Big Sky relief effort? And I'm just in awe of the response we got. We had $410,000 that was verbally committed to return to Resort Tax to help out on this effort. And I want to give a big shout out to those organizations that stepped up. We have the Chamber of Commerce, the Big Sky Community Organization, the Post Office, the Gallatin River Task Force, the Big Sky Community Housing Trust, Search and Rescue, Transportation District, Visit Big Sky, and Wampac, all committed to return funds that total up to $410,000. So our next action, now that we know that we had the legal standing to do some emergency allocations, and we knew that we had funds available, we had an emergency Resort Tax Board meeting on Friday the 20th. And there were two notable action items that happened at that meeting. The first was Resort Tax committed $500,000 to the Big Sky Medical Center. And then the second was the resort tax committed $500,000 to these other efforts for government and nonprofit entities in our community. That was quickly matched by the 3 community foundations. So by the end of that day, Friday, we had $2 million raised towards this effort to help Big Sky. Ballpark $1 million of that to the Big Sky Medical Center and $1 million to these other needs in our community. On this last Friday, the 27th, the application process for the nonprofits and the government entities went live. So that is now live on bigskyrelief.org. We are working with the Chamber of Commerce. This is a live discussion on how can we help the small businesses. So Joe, to one of the comments or that came from one of the listeners, more to come. Candace gave a great overview of some of the federal and state programs that are out there. So we're really trying to understand those. And then we'll try to understand if there's some other role resort tax can provide for small businesses that isn't being addressed at the federal or state level. And then lastly on the individuals, and this is really where YCCF and Loren, Bough and the team have grabbed the ball and are running with it, is setting up how do we help the individual. So Eric, that's real quickly what we've been able to muster in a short period of time on the financial end. And I'd like to let Danny talk about really the coordination and communication role that we've been trying to help the Big Sky community out during this period.
Okay, great.
Thanks, Kevin. So I really appreciate the hashtag that you've been using is Be Strong Big Sky. And in my opinion, and the ability to be able to work in coordination and help facilitate communication between all of the partners in Big Sky. Big Sky, you are strong and you have wonderful leadership behind supporting this community, and you truly are better together. Some of the things that have been happening behind the scenes is the group of coordinating partners has been meeting twice a week, and through bigskyrelief.org, our efforts have been towards really trying to facilitate communication, understanding your needs, and bringing the partners up to speed with what needs exist and helping to bring that full force. That's being done through a variety of partners, including the Big Sky Medical Center, thanks to Taylor Rose and Jason Smith. Wonderful leadership there. Great leadership through our emergency services, Greg Meagard and the Gallatin County Sheriffs, as well with Sergeant Brandon Kelly. Sarah Gaither and the Food Bank have done a wonderful job of ramping up to meet the needs of food services within our community, and appreciate their efforts. And a huge shout out to Jean Bear as well with Women in Action. And you heard some of the work that the mental health services have been transpiring as well. Transportation's also a part of that group, the coordination group of operational partners, as well as VBS and the Chamber. So huge thanks to David Cack and Candace Carr Strauss for participating in that group. Volunteer efforts and trails are being coordinated through BSCO. Sierra Wolf has been leading the charge on that front, and it's been great to see their work as well. Dr. Dustin Shipman has been representing the Big Sky School District and that operational partner meeting that has been happening twice a week. So you can find those notes twice a week. Those meetings are happening on Tuesdays and Fridays, and you'll find those notes on bigskyrelief.org. There's also been resource partners meeting weekly, which include all the partners that have been spoken to earlier related to fundraising partners with Loren, Bough and YCCF, Moonlight Community Foundation, and Heather Morris and John Haas as well. In addition to the funding partners and the philanthropic support that is being brought to the table, there's also personnel and supplies through a lot of the private sector here in Big Sky. So Cross Harbor, Matt Kidd, Lone Mountain Land Company, Kevin Hinkle and the group there, YC, Yellowstone Club, Hans Williamson, and Big Sky Resort with Taylor Middleton and Troy. Thank you for your support there. And some of the examples of the ways that this group has been working is, for example, when we were standing up the website, Emily McGee with Lone Mountain Land Company was freed up for a few hours of support to be able to help us stand the website and communications up to get out to you all. Volunteers were made available for cleaning out Big Sky Medical Center through Lone Mountain Land Company, Moonlight Basin, and Suffolk Construction and Jackson Construction. And moving a new shed over there to Big Sky Medical Center was made available through some of those partners as well. What you'll find through the communication that is filtering up through bigskyrelief.org is there's a variety of methods to stay connected. You can stay connected through all the social channels. Facebook, we've got a Facebook page with Big Sky Relief. We've got Instagram, we've got YouTube, which are all opportunities to stay connected. If you want to ask us questions, or if we're missing a need that isn't made available for pointing you in the right direction for a method of relief, you can just contact us on the website. You'll either receive a phone call directly from me or an email from one of our team to help try to provide some support. Talk to many of you here in Big Sky. Thank you for reaching out. That is an option. But we will also continue to coordinate communication as we continue to release funds and collect applications as well through the methodologies that Loren commented on earlier today. Some normal methods of business are happening through the resort tax, through the behind the scenes as well during this time of the COVID crisis. But we do have our FY21 applications process underway. This is a year one of a multi-year process that is working on focusing our investments in a strategic way and really focused on highlighting the needs that were outlaid in the community strategic plan. We do have a new online portal for filling out applications through the Big Sky Resort Tax. And we're encouraging things like matching funds and increased collaborations, and really focused on living that motto of better together, and focused on really a high level of project impact. You'll see that moving forward. We do have a vote up and coming. We do have an election that is happening right at this time of need with COVID-19. So there's a 1% for infrastructure vote that you'll be seeing info sessions that are made available. We have one up and coming this week. In fact, with the Water and Sewer District, and mailers will be going out as well. One thing of note, you know, the 3% of the resort tax will be heavily challenged this year in ensuring we're delivering the highest level of impacts possible. And the 1% will be another opportunity for being able to keep the Water and Sewer District project separate from those 3% funds. So it's increasing the pie for everyone. And finally, just wanted to note that the district is finalizing our very first strategic plan, a 3-year strategic plan with 3 core priorities. So one of those is engaging our community. Hopefully you've seen a much higher level of engagement, both through this COVID-19 situation, but also as well through the past year. Strategic investments are going to be a high priority for us, and ensuring that we're using your dollars in the best way possible to make sure that we're delivering a high level of impact. And then also a culture of excellence. So those are some of the things that are happening with resort tax in 2020 thus far.
Excellent. Well, you guys have had your plate full, so thank you for that. And you covered a tremendous amount of information there. So thank you, Danny. That actually gobbled up a lot of my questions. So you really crushed it. And thank you, Kevin. Joe, do you have any follow-up questions for resort tax before we kind of switch over to the group?
Yeah, do have one here. You know, Kevin, I wanted to address you for this. There have been, you know, a number of businesses and organizations using, you know, ingenuity to get by in these difficult times. You know, including the Resort Tax Board and local foundations, you know, with the relief fund. I was curious if you would be willing to, if you can share one of these positive stories about community and resilience.
So, Joe, I appreciate the question. And one of the, you know, pages that we're going to add to the bigskyRelief.org website is, you know, we want the community to share the positive stories that are happening out there, because I do hear about them and I do experience them. You know, on a personal level, you know, I have a college-age son who's home spending time with me right now. And to be honest with you, when he left my house 1.5 years ago, I thought I'd get him 1 week at a time for the rest of his life. So I'm very grateful on some of the things that, I hate to say it, that this pandemic has brought into my life. Your specific question on what are the innovative business adaptations? Well, I think we've talked about this earlier, and it was really great to hear Gary Rieschel talk about, you know, is the telecommuting really going to change and become part of our way of life? I think I've learned no short of 5 different video platforms this last week. So really, we're all learning and adapting. I think that we have found that life does go on. You know, we are able to keep balls moving forward, both as a community as well as and the private business. I really do think, there was a question earlier about, are people being encouraged to come to Big Sky right now? And I can tell you across the board with the private businesses and the hospitality working with the hospital, initially it was, we need to stop taking reservations. We need to do some things immediately to help out our medical system. I think long-term, what you're going to see is Big Sky in Montana is going to be more desirable than ever. And I'm just very thankful that I'm here in Montana right now.
Great. Well, thank you. And thanks to you, Danny. I really appreciate your guys' time and for joining us. And yeah, we'll go back to you, Eric. We've got a couple other questions following up.
Yeah, so Joe, while you look at that, and we've reached the end of our panelists, we'll go ahead and just field probably another 5 minutes of questions, and then we'll wrap this thing up. Joe, why don't you kind of go through, and maybe we'll try to grab a couple of the top questions that have happened, and then we'll bring some closure to this. And Joe, you're muted, so.
Sorry, there we go. There's a question for Taylor, about supply chains. And Taylor, we're wondering, how are supply chains holding up for essential items, medical supplies, medical providers, et cetera?
I think right now the hospital, we're actively looking for additional supply chain resources. And it's more future planning than an immediate need that we have right now. I mean, the media that you read every day is pretty clear that there are deficiencies, and we're looking for other sources. But I mean, it's the current environment that we're in, and we're looking to change processes to reduce our use of specific types of PPE and other critical items that we are in need of. I think, there's a supply and demand part that goes into everything. So we're trying to reduce demand as much as we can, not just through reduced patient encounters, but also the way we work and the way we do business. And just, we're looking at every aspect to be able to utilize our supplies that we have better.
Gotcha. Thanks. Thank you for that. We've got a question again, Taylor. We've got a question from Suzanne. There were so many people in Big Sky who were sick with the exact symptoms of COVID-19 in December and January. Is there a possibility COVID-19 was in Big Sky earlier this winter and not diagnosed?
Yeah, as far as, is there a possibility? Yeah, there is. I mean, the diagnosed cases didn't start coming in until the last few weeks, the last couple weeks. So there's always that possibility. And, the general flora and fauna of bacteria that's going to be in the community always changes. And this disease does mimic other diseases. So it could have been that, it could have been the flu, it could have been many different things, but it's kind of hard to say.
Sure. Thank you. Candace, a question for you. What are current projections for, and this is up in the air, but what are current projections for when Big Sky businesses might reopen and what life might resemble normalcy to some degree again?
Oh, I think that question would have to go to our governor. Being that he's the one that keeps putting out the orders, just got moved to April 17th. So I can't really speak to that. We are doing some scenario planning around lodging tax and resort tax collections. As Danny mentioned, we are in FY21 allocation process. And so in working with the state tourism office, as well as some local partners, we are doing some different scenarios for what that's going to look like depending on when they do open.
Got it. We have a question here for Loren. Diane asked, will this pandemic delay the vote to approve the expansion to our Big Sky schools? And the second part of that is, what about the primary in June, if heaven forbid we are still sheltered at home?
Well, regarding elections, it appears that a mail-in election is going to be the only type of election we have. We launched the campaign for the school bond, and again, probably about a month ago, which feels like 10 years ago from the standpoint of a lot of things that have happened. And so that's on the levy, and we'll be voting on it. And actually, you'll be hearing from the school. We think that the community deserves to have its voice heard about this. There's been a lot of appreciation for the way the schools approach this. We can also see scenarios where we have more and more people moving here full time now that they've tried out work from home or work from Big Sky. We actually think that there'll be an even further increase in the student numbers that we have going forward, especially in the kind of scenarios that Candace mentioned, that assuming we get back to business at some point this summer, we think we might see an uptick in the number of students enrolled in September. Just to mention that we've had a large number of students wanting to enroll in our virtual classroom online for different parts of the country, because we've been one of the only schools going online.
Mm-hmm. Mm-hmm. Thanks.
Hey, Joe, can I just say a word about the primary election? Governor Bullock did just call for counties to make a decision about whether they wanted to have an all mail-in ballot. We had actually been calling on the state to do that because we did think it was really important to make sure that folks had their ability to vote safely. You guys at Gallatin and Missoula, a number of their counties have already said they're going to do all mail-in ballot. So it's just a matter of making sure that you're registered and that the state has your correct address. One other pitch, if I can just make really quick, is the census, which now more than ever is important for Montanans to get counted for all those resources, right? The number of Montanans directly correlates to what type of federal resources we get. So please be sure, if you haven't gotten your mail already for the census, we had thought, again, folks would be on the doors, going door to door to try to get people signed up. Obviously, that's not going to happen. So it's just census.mt.gov, and it literally takes less than 2 minutes. You just go online and make sure that you and your family members are counted, which, again, now more than ever, make sure that we get everybody in the state counted. So folks can do that as well.
Thank you, Whitney. That's really helpful. And yeah, we got to be counted, people. So get out there and get the census. I have a question here for, and I don't know if Kevin wants to answer this or Loren, but so Big Sky has a large number of migrant workers in various areas. One being the construction trade. Are there any specific discussions or efforts underway to support the migrant worker population in Big Sky as it relates to COVID-19?
Sure, I think I can Kevin might have something to add, but we made a couple things. First of all, we have English as a second language learners at the school. We've reached out to all those families. We've made sure they're aware that we're doing the free lunches at the school. A number of those families are taking advantage of it. And also, we've ensured that the landing site on the website, bigskyrelief.org, that there'll be a Spanish language option. So Spanish speakers will be able to also apply for funds easily and readily, the same as English speakers can. I think those two will help. We certainly are aware that that's the most vulnerable part of our community, and we want to be very sensitive to including them in our efforts.
Mm-hmm. Kevin, anything to add to that?
No, I think Loren did a great job covering it.
Gotcha. That is definitely helpful. From an actual healthcare perspective, are there plans, for some of these people? I think English as a second language is huge. Didn't know if there was any money earmarked or any plans going forward for that population of our community.
Joe, is that a question for Taylor?
Yeah.
Or?
That was for Taylor or Loren. Yeah.
Bozeman Health is a non-for-profit organization, and they do provide patient financial assistance. There is an application process to do that. So I would just recommend that if people do come in and they do visit and they do have financial needs, that they reach out and look for those resources. There's a lot around COVID that is getting paid for by the government. So if you are getting treated for COVID and testing, there may be resources there. Still too early to know everything that's going to happen there, but there are resources available for those that do need it.
That's definitely helpful for people to know. And yeah, it's a tough part of the situation, but I think we probably have. Oh,
Right.
sorry, go ahead.
Oh, sorry. To answer that question, Big Sky Relief is in constant dialogue with Bozeman Health and Big Sky Medical Center about what their needs are, and they have they have a lot of possibilities have been discussed: more masks, more surgical equipment, more rooms, but one of the issues they have touched on is they're worried about the number of underinsured or uninsured who might be turning up, and so we're open to that dialogue with them, but it'll be based on what needs they actually see.
Mm-hmm. That makes sense.
Righty. Well, we have reached our time limit, and I'm to be respectful of everybody that's watching and all of our panelists. We're going to go ahead and bring this to a close. I'm so grateful for everybody's time today. I think to go through and some of the learning points, on behalf of the Big Sky Medical Center, Taylor, thank you once again. They seem very prepared and ready for this, and on all fronts. And as of today, there's currently no one admitted to the hospital. So, so far so good. And let's hope that we can continue to flatten that curve. The Big Sky Chamber of Commerce is a great resource, and Candace and her team have done a great job compiling information for small business owners to help sort through that. So please use them as a resource if you need that. And they're looking to the future on how to put this gas back in the tank. Gary, Rieschel, phenomenal knowledge and great insight. And I think the big thing that I took from him is the game has changed. And this is not only going to be a tough one for us to get through, and we will get through it, but in terms of the business landscape, a lot of things have changed. So we need to be prepared for that. Big Sky Relief and Loren, they're in this for the long haul. And that's great to know that we've got that sort of backstop for a lot of important community members, businesses and charities. So nice to have that the relief fund is there and that the school is well organized, and 48 hours into it, they had their kids online. I'm sure the parents appreciate that tremendously. From Whitney and her look at the state, obviously it's a big state and there's a lot of need. And if you're looking to get involved outside of Big Sky, there are ways to do that. And don't forget to complete your census. I did mine yesterday, very important for a lot of reasons. And that is something really important that we all go and do that in Montana. We're right on that tipping point of being able to get our population to a level to make sure that we're getting the adequate aid. And then to finish with the resort tax, all the great work that Kevin and Danny and his team are doing. And I think that the word partners is critical on that, and all the great work that has been accomplished there. So let me close by this, and then we'll let everybody go. I once again am grateful for all the panelists and your attendance today. We plan on hosting more of these town halls in the coming weeks, and we will let you know as we schedule them. If there's topics that you would like covered in more depth or other topics, please reach out to Outlaw and let us know. Let me take pause here for a moment and thank Joe O'Connor and the editors at Outlaw Partners. They have been working in tireless hours and burning the midnight oil and doing a great job in covering this for the community. So very grateful for Joe and his team. And lastly, let me be the first to go on record on our media platform in saying that as a community and economy, I look forward to all of this passing and recovering, but I hope that we don't go back to the way it used to be. This pandemic has been a gift, as Kevin kind of alluded with his son, in allowing us to gain perspective on what's important to us and how fragile life and the economy are and how interconnected everybody is. And that's one reason we wanted panelists from around the area and not just in Big Sky to once again show that interconnectedness that we've got not only in our community, but state and world. While we're resilient and we can go back to making money and building towns, we must all remember that some of the lessons we are learning now must be carried forward. It's important that we work closer as a nation and as a state and community and political parties. We also need to work during these times to support our community more and more. And we need to remember to always be gracious, and not just in the times of crisis, for all of those people who take care of us, all those medical care workers, first responders, and the charitable entities. There's millions of people out there that don't have the safety net that Big Sky has, and let's make sure that we go to bed at night thinking of those and wishing them well and trying to find ways to help them. And we also need to remember what's really important: family, friends, neighbors, community. And also creating legacy through thoughtful growth of this region and our town. On behalf of all the panelists, once again, thank you for joining us today. There was one panelist that didn't get a chance to voice her opinion today, and that's Mother Earth. Let's remember to cherish and protect her always. It sure is great to have her out there, and we got a lot more time to spend there. So make sure we take care of her, not only now, but in the future. Once again, I wish well to everybody. Thank you for taking some time out of your calendar to join us today. Thank you to the panelists and all your great knowledge.